Good morning, ladies. I'm Sarah from Go Figure PT. I'm also a specialist in women's health and fitness and also work alongside as a practice nurse. So I am here to speak to you today about your smear and maybe the implication that menopause may have on you potentially avoiding that smear or maybe not going for your smear. So first of all, let's talk to you about why do we have a smear. So we have a smear, it's a sample that we take, hi Sally, it's a sample that we take to see if there is HPV present on the cervix. So HPV is called the human papillomavirus, and this virus, when present on the cervix, can go ahead to lead to abnormal changes within the cell. Those abnormal changes can go on to lead to cancerous cells. So for that reason, it's really important that we ensure the health of our cervix and we have our samples or we have our tests done as and when they are sent to you. So for women, your smear, you are invited for your smear every 3 years up to the age of 49 and every 5 years after the age of that up until 64. If you've had any abnormal smears in your previous history prior to the age of 49, that invitation to smear might change depending on your results of your treatment. If you find that you have any abnormal symptoms, bleeding, discomfort during intercourse, any real pain, abdominal pain, it's really important that you go back to your GP in between your smears and get these checked out. They won't actually repeat a smear in between your 2 smear time frame, but they will refer you to gynae to ensure to check that everything is fine. And at that point, if they feel that an additional smear is needed, they will take another sample. So there are several strains of HPV out there, but predominantly we look at 4 main strains which we're looking for when we take your smear. In the past, when we took your smear, we used to take the sample, we used to go ahead and test for any abnormal cells, and then once we found the presence of abnormal cells, we then used to test for HPV. So the testing has changed in the last 12 to 24 months, depending on which area of the UK that you live in. And that test now, your sample goes straight to test for HPV. So it kind of narrows down the time frame, and we're getting our results much quicker. Now saying that, the COVID obviously has its own kind of disadvantages and halted smears for a certain length of time. But I believe that now all practices are back up and taking in patients for their smears and calling you back in for your smears. So when it comes to your smear, what can we expect? So we're just going to have a little look at the vagina. I know we not always want to have a look at our body parts, but it's something that we should be very familiar with. It's part of our body, and it's really important that just like we can see the integrity of our skin and see what's going on with the rest of our body, then internally we have an idea with what that looks like, first of all. So I've got a little picture here, and as you can see, we have the cervix, or the vagina. The cervix is this tiny little entrance here. We have the uterus, our fallopian tubes, and obviously our ovaries. So when we come to take a sample, we come and use a little brush like this, and we pop this here, and we just go ahead and take a sample right from the neck of the cervix. So we're not taking that brush any further, we don't need to. We're literally sitting at the entrance of the cervix where we know that actually that virus can sit quite comfortably and quite happy if it's present in the body. Now, just like a virus, it can stay dormant in your body. So if you've ever had a cold sore in the past, your cold sores don't often come up. They kind of come up at times when the immune system is a little bit run down, or at times of stress can also trigger these, are sometimes light. So the same thing is with your HPV virus. It can stay dormant in the body, which is why even if we come to the age of 46, 47, or in our 50s, and we're thinking, I've got one partner, I haven't had any unusual symptoms, I don't really need my smears. Because this virus stays dormant in the body, it's really important that actually you do consistently go for your smears when you're invited for your smears. We don't know at what point that virus could potentially trigger, And it may be that you don't have that within your body, that's fine. But in the absence of knowing this, we'd rather be safe than and ensure your safety and the health of your body. So when we take your smear, we've all been there. Pop us on the couch, pop you on your back, ask you to open your legs and relax. And it's really difficult to have a stranger, we may know our practice nurse, we may not, to come and be very intimate within our body. So when it comes to the smear and we're popped up on the couch, we're asked if we are still menstruating or having our periods. For those of us who our periods have stopped, we're asked if we've got any additional symptoms, or dryness, or soreness. And as a practice nurse, we really do listen to you guys when it comes to that. So we're going to talk about that drop in estrogen and in just a couple of minutes after we go through talking about your smear. So in the past, we used to use metal speculums, cold metal speculums. We used to do these smear sample. Sorry, brain's gone dead. We used to take your smear by using quite a rough implement that would take the sample off the cervix. I'm completely throwing myself now. So now we start using these little brushes. They're almost like the head of a toothbrush. They've only got a couple of little brush heads here at the top, and we pop that into the cervix, rotate that for 5. It's got little scoops at the end of the brush, and then we take that and agitate it and pop those in our pots. And that's our sample taken. It is a very quick procedure, however there are things which obviously can slow that down. So the first thing that we do is, if you are going to have your smear and you know, for example, that you're very uncomfortable, your smears have been uncomfortable, perhaps you've got, you're in your menopause and you feel very uncomfortable down there, you've got some dryness, some tightness, soreness, perhaps sex isn't as comfortable anymore, and in general you're just quite nervous about your smear. So the first thing I would say to you is, please contact your practice nurse. Please have a chat with them. They want this procedure to be as comfortable as possible for you. And at that time, we will also talk to you about possibly the different types of speculums. So this is a speculum here. And when we go ahead and we insert it into the body, we literally insert it into the vagina, and we literally only open it that much. We just need enough space to get this little brush down through to take our sample and then to remove it. So if you are really concerned about potentially that big speculum going in and the really opening and gaping wide speculum, that's not what we do, guys. We tend to just open it as much as we need, sometimes very, very little. And again, this is a medium speculum here. So this is one that's often used on most women. As you can see, I can get my fist around it very comfortably. But we have got smaller speculums to use if that's the case. Okay, so let's move on to the impact of menopause and perhaps maybe what's happening down below for you, and ways in which you can make your smear a little bit more comfortable. So it's quite common as we come into our menopause that drop in estrogen can cause what we call vaginal atrophy. And basically what that means is those walls of the vagina that were once nice and plump and hydrated and nice and healthy, like the inside of your mouth, become very dry and drop. And basically any time within the body that any of those tissues become dry and less hydrated and less plumped with those hormones, it can cause those tissues to sometimes shrink and stick together. So everything becomes a little bit tighter and a little bit snug. And this can be quite uncomfortable for a lot of women, not only in their smears, but in their day-to-day life. So what can we do to help with that? Because obviously that is going to have an impact on how your smear goes for you. So the one thing that we do know is that you can take HRT as you're traveling through your menopause. Now, I'm not advocating that you take hormones. There's also topical hormones which we can take into the vagina, rubbing onto our skin, or a pessary ring, or what we call Vagifem, which is a tablet that you insert, a little bit like a tampon, and that disperses and melts and it stays within the body for a couple of days. Now, if you are really hesitant to heading down through to artificial hormones, and we're only talking about for your smear, because for your smear alone, you can go and have a short course of what we call Vagifem, which is that little tablet I described. And you take that maybe for a couple of weeks or 2 weeks prior to your smear. That helps to rehydrate and plump everything up. And then 48 hours before your smear, then you stop taking that, or you make sure that you have a 48-hour window before your smear so it doesn't impact your test results. And then that allows you to have a little bit more of a comfortable smear. There's also natural products on the market, and one of these companies that are producing these natural products, I'm not a rep and I'm not pushing it, but it's one that I've come across, and it's the Yes product. So Yes is, not sure if that's the right way around. Yes, it's a product that you can go ahead and it's a water-based lubricant that you can get, and it's an organic-based lubricant that you can use, which also on a day-to-day basis can help, and also prior to coming up to your smear can help. So the one thing that I would say, if you are that person who's really struggling and really anxious about your smear, please don't avoid the smear. Please go ahead and make a previous appointment with your practice nurse or your GP. I'd probably say practice nurse, because more likely it's 99% of the time it's going to be your practice nurse taking it. If your practice nurse feels at that time that it's not appropriate for her to take it, then she will refer you on. I'll put the name of the products and some of those artificial, just the names within the comment sections, guys, just so you have something to have a think about if you do end up heading to your practice nurse to have a chat about this. So again, it's not necessarily that I would always recommend hormones. They're very individual to your choice, but this smear test is actually really, really important from you. It's quite a silent one in the body, and it's really difficult to diagnose outside of your smear. But again, if you have any vaginal discharge, i.e. bleeding, if you have any bleeding post-sex, if you have any real soreness, these are all symptoms, regardless of your smear, you should be going to your GP about. Now, bleeding after sex and intermittent into your period are not always down to HPV. Often we have a little polyp sitting there, which is quite vascular, so there's quite a lot of a blood supply, and that little polyp is quite harmless, but if we irritate it by inserting anything into the vagina, then that itself can bleed, and it's important too that we keep an eye on those. So I'll pop the products in, and please feel free to ask any questions or pop in the comments. I'll keep an eye on some of the comments, and if I can respond to those, I'll respond to those. So remember, ladies, please head for your smear. If you are that lady who's really anxious about your smear, please make a previous appointment with your practice nurse and give yourself that time. At the moment, the practice nurse schedules are not completely crazy. They're still starting to ease back into taking patients in. Even a telephone conversation with you may be just enough for that practice nurse to be aware that actually you're quite anxious about your smear. We want this procedure to be as comfortable as possible for you, and we also want to address any other symptoms which are happening within your body to make you more comfortable as a woman. So that drop in estrogen in our menopause can play havoc on quite a few of our bodies. Not only does it affect the lining of the uterus or the lining of the cervix, but it also can play quite a big impact on also bladder, and sometimes can lead to some incontinence issues. So if that's you, please get in touch with your practice nurse, have a chat with them, and let's get everybody out there taking their smear test.